Assalamualaikum everyone. Welcome to tonight's episode of The Health Show. My name is Dr Sulthana Ahmed. I am a local GP and your host for tonight. I hope everybody's doing well and having a good Tuesday so far. So this week we have a very topical and relevant discussion for you. We will be discussing the COVID-19 vaccination. Now, with cases back on the rise, yet lockdown set to ease, this makes for an interesting discussion. Now, earlier on this week, we did reach a very good milestone where 50% of the UK's population have been fully vaccinated. Whilst that does sound like a really large number, and it is, there are still 33 million people who are only partially vaccinated or unvaccinated. So to discuss this topic in more detail, I have with me a Dr. Jamie Parker, who is a GP based in Nottingham. Thank you so much for joining us this afternoon, Jamie. How are you doing?
Yeah, good, thank you, Sultan. I'm reading after a very long day in general practice, as I'm sure you can appreciate.
Yeah, absolutely. I really appreciate you coming on, and I can imagine what your day has been like today. So thank you so much. Now, I was actually shown your Instagram page by one of my non-medical relatives. She absolutely loved your videos. She found them informative, quite succinct, and she is obviously Muslim, and she did like that some of your videos were targeted to specific issues relating to that community. So your videos definitely filled a gap that existed.
Really, that's very kind. Thank you for feeding that back. I'm glad it's helped.
So for people who may not know you, are you able to tell us a little bit about yourself and what you do?
Absolutely, yes. So my name is Dr. Jamie Parker. I'm, as you say, GP in Nottingham, and I do that full time. During lockdown last year, I wrote a song cover of Frozen's Let It Go and called Stay at Home, and that was right at the start, and that went viral. And I was on regularly on sort of BBC Breakfast show throughout 2020, sort of giving advice about COVID and at the last stages, some bit about the COVID vaccine. And then I got approached by a UN-backed group called Team Halo at the end of 2020, who said, look, the vaccine's out, we really need to spread the word globally and sort of dispel some of the rumours and the false news that was going around about the COVID vaccine, because it's so important that we get as many people in the world vaccinated as possible. Will you help us by making videos on TikTok? And I was a bit TikTok, I think I'm a bit old for that, but I have done. So that's where the Instagram came out, because I sort of share my videos on TikTok, also on Instagram.
Yeah.
And, Team Halo is a group of scientists and doctors around the world. Most of the group make far more interesting videos than me and much more interesting to watch. It's amazing. We've had over 100 million views on social media worldwide as a group. On TikTok, I've got about 150,000 followers now. And Instagram. So hopefully it's making a difference. And I said, I'm probably the most boring person on TikTok. So I literally sit down, as you've seen in my videos, and it's like 15 seconds of just some brief but correct information about the COVID vaccines that just may help people who perhaps have questions or worried about some of the rumours they've heard.
Yeah, I think what's great about your videos is that obviously you are a real doctor, you come across as someone who's quite genuine. And what I was interested to know before we get started with the questions that people sent in was, apart from Project Halo asking you, was there anything else that kind of compelled you to write that song in the first place, or to make the videos in the first place? What is it that motivated you?
The song initially, so in 2020, was really out of a sense of guilt, because I don't know about you, but I was very blasé about the pandemic before it actually got to us. Even when we were seeing it in Italy, it suddenly dawned on me just how awful this could be. And I sort of felt compelled to do something over and above just being at work. And I'd been out with my 3 kids on the Saturday, and just seeing how busy it was out and about still, despite that sort of stay at home, that people weren't staying at 2 meters. And I just thought I'd write a song to try and create, to try and spread the word, basically. And then from there, the reason for saying yes to the Team Halo group was, again, that element of being able to go over and above, I think, as well as providing I don't know, it's almost kept me going, as well as a different way of thinking about things. Because, as you know, work's been extremely difficult, and just being able to sort of feel that you're going over and above and thinking about the pandemic in a creative way that can help other people, I think has been helpful in terms of keeping me going as well.
Yeah, absolutely. I mean, I have spoken to a couple of other social media doctors who feel that the whole process of sharing medical information on social media is also quite cathartic for themselves, and they do find it's a creative outlet, so it helps themselves as well as those reading the information, which is...
sorry, sometimes to interrupt, but I think also you make a good point there that I think the medical profession, they need a presence on social media.
100%.
You know, I hope that it's taken over by people much more interesting than me going forward, who will be able to do it a lot better. But I think the more presence we have, because actually lots of people get their news and information from social media now. They don't get it from watching TV. And so I think the higher quality information that's available out there, the better.
Yeah, absolutely agree with your sentiments there. So let's talk about COVID and the vaccination. So as it stands at the moment, the UK in particular has done really well with this vaccination programme, thanks to the NHS and its staff. But we are seeing that the cases are on the rise, although a silver lining is that not as many people are being hospitalised as you would have expected, and we are putting that down to the effects of the vaccination programme. So some of the questions that we had, people are obviously still hesitant, certain pockets of population, certain specific groups, for example, women who may struggle with their fertility or are pregnant or are breastfeeding, would like reassurance or specific information about their situation and the COVID vaccine. So if it's okay with you, can I run through some questions that we got for this episode tonight?
Absolutely.
Okay, so we will start off with COVID vaccination in pregnancy. So as it stands, what is the current advice?
So the current advice is that the vaccine should be offered to pregnant ladies in line with their risk factors and their age. So basically similar to the rest of the population. That changed a few weeks ago. Before then it was pregnant ladies with specific risk factors that make them more likely to become seriously unwell with COVID. But that's changed now to bring pregnant ladies in line with the rest of the population and to be offered it in line with age. And that's according to the JCVI advice.
So a few of the questions we had were, well, you know, I'm in the first trimester of my pregnancy. I know this is a really delicate phase. Should I defer getting the vaccination and maybe have it later on?
Yeah, I think it's really important to remember that it is a personal choice. I think, you know, you're not going to be forced to have the vaccine. And I think that as with most pharmaceutical products, the evidence for their use in pregnancy is going to be limited. I think what we advise in pregnancy is you discuss it with your healthcare provider and you make an informed as choice as you can about whether to have the COVID vaccine in the pregnancy. I think there are some things we do know, that we know that COVID-19 may be more dangerous in pregnancy. So although still for the most people who get COVID-19 in pregnancy, it will be a mild and self-limiting condition. For some people, it will be serious. And for pregnant ladies who get very unwell with it, you're more likely to have stillbirth or premature birth than pregnant ladies who don't have the COVID. We know that the COVID-19 vaccine is very good at preventing, we know that it's effective at preventing severe COVID-19 hospitalisation. And the other thing to remember is that you can't get COVID from having the COVID-19 vaccine. I think that's something that people worry about. So you can't get the COVID illness from having the COVID vaccine. I think what there isn't the evidence for, and as I said with most pharmaceuticals, is its complete safety in pregnancy. Yeah. But lots of vaccines are given in pregnancy with no problems. It's not a live vaccine, so that's not an issue in pregnancy. And the data from the US so far, which is generally been looking at the Pfizer or the mRNA vaccines, studies of over 100,000 doses given in pregnancy have not shown any significant safety concerns. So it's all looking very reassuring. I think after a discussion, the advice would be that you can have the COVID vaccine in the first trimester of pregnancy. That's not a contraindication. The vaccine that you would advise to have would be the Pfizer or the Moderna mRNA vaccine, because there's more evidence for its safety than the other ones. I know that some women are choosing to defer their first vaccine until after the first trimester, which is when most of the development of the fetus is done. But that's not sort of strictly according to guidance, that is personal choice. And the other thing to remember is that the evidence is that tends to be that the later in pregnancy you get the COVID, the more serious it can be. Yeah. So it's important to get it before that third trimester as well. So I think there are lots of things to take into account there, but there's lots of trusted sources of information on the Royal College of Obstetrics and Gynecology website. It's really good. The UK TIS website, again, to try and help women make that informed choice about whether to have the vaccine in pregnancy or whether to wait for more data to be available, bearing in mind the previous discussion.
Yeah, and I think it is the should I wait for more data that I know a lot of my patients are stuck on. And I think you made some really good points there about actually we know that any infection during pregnancy is best avoided, including COVID. And you also pointed out we do vaccinate against other conditions in pregnancy, for example, the whooping cough and things like that. So it's not completely unheard of for pregnant women to get vaccinated. But like you said, it's, a kind of individual decision. And if you have really specific concerns, then do speak to your GP about it. I think concerns about fertility very quickly have been debunked. What do you say to that?
Absolutely. I mean, I know that fertility is a very important topic, and lots of people are worried about it. And there's been a lot of false news and rumours spread on social media about that, designed to put people off for whatever reason by anti-vaxxers or whatever in terms of their motives. But in terms of there is no evidence that the vaccines affect fertility, and no credible scientific reason why they should affect fertility. In terms of absolutely being able to say that there's evidence to show that they don't, that evidence isn't there yet, but we expect
we should wait for it, yeah. Excellent. I'll just hold you there, Dr. Parker. This is a great discussion, which we will continue after the break. Please do come back to join myself and Dr. Parker. Welcome back to The Health Show. I am your host, Dr. Sulthana Ahmed, and you are joining me having a discussion with Dr. Jamie Parker about COVID-19 vaccination. Now, we've got tons of more questions, so I'm going to get straight to it. I know recently, anecdotally, lots of patients, friends, colleagues have commented about changes in menstruation after the COVID-19 vaccination, and also after the COVID-19 infection in some cases. And it kind of emerged that some of the trials may not have actually collected that data on menstrual cycle during the trials. Are you able to tell us a little bit more about that?
Oh, yeah, I can try. I will say that I'm not an expert in this area, but I have, again, sort of read about this sort of anecdotal evidence, and there are studies that are ongoing to try and see if that anecdotal evidence is actually causative. Are those changes in menstruation caused by the vaccine or COVID, or are they sort of associations? Either they were going to happen anyway, or it's just sort of an association in time. But it wouldn't be surprising from my reading if actually that there was a link. We know that with other vaccines such as the HPV and the flu vaccine, that there are short-lived changes to the menstrual cycles. You're giving the immune system a shock, essentially, and we know that the immune system is involved in the breakdown and the sort of makeup and lining of the womb. So it wouldn't be surprising if there was a short-lived effect on the periods. But I think very reassuringly is that there's no evidence that will affect fertility or any sort of long-lasting effects from that. So even if it does show to be sort of a cause rather than just an association, again, that doesn't seem to be anything to be worried about.
Yeah, and I think another interesting point to make also is, women's menstruation are affected by a number of different things. And so, globally, we have all been going through a pandemic, and it's also plausible that stress, changes in behavior, diet, weight, exercise, all of those things can also contribute to the widespread potential changes in menstruation that women have been reporting. And as you have said, I know that the MRHA had put out a statement that they are actively looking into this now to try and establish whether it's just an association or an actual cause, like you said. So as with most things COVID relating, time will tell. But for now, it's probably something to be aware of, maybe something to monitor. And if you are able to, if you have noticed something, do discuss it with your GP or report it on the yellow card system as well, which will help with data gathering. The next thing I wanted to talk about was, and this was kind of quite topical a few months ago, and patients do seem to be a bit reassured about it now, it's to do with COVID-19 vaccination and the clots. So if, for example, so one person messaged in saying, they've got a vague family history of clots. They're not too sure what the actual conditions were. They're not able to ask their relatives. Should they have the vaccine? If so, which one? So I appreciate you can't give direct medical advice, but what would you say to that generally?
As you say, I think it's been a really common theme, actually, of all of the things that have been reported. Actually, people seem to have picked up on the clot one the most. And it seems to be mainly with the first dose of the AstraZeneca has been the risk. I think the first thing to say is that it is still, although it's been reported, it is still extremely rare. I think it's about 14 per million first doses now. It does seem to be more common in the younger generations, which is why the reason in the UK now in the under 40s that you're offered the Pfizer or the Moderna rather than the AstraZeneca. But even if you're the risk is still extremely small. I think the next thing to say is that the mechanism behind the clotting is very different to the much more common clotting disorders that people are probably aware of, things like DVT or deep vein thromboses after flights, the clot risks that are associated anyway with pregnancy or being on the combined pill. The clots that seem to be associated with the AstraZeneca vaccine have actually got a very different mechanism, and so that for most of the common clotting conditions, that's not a reason to avoid. It's not a contraindication to the AstraZeneca vaccine.
Okay, thank you for that. And so another question that we had, and you actually addressed this in one of your videos, is, they had the AstraZeneca vaccine for the first one, but they're actually, I think this gentleman was younger than 30, and they were querying whether they should specifically ask for the Pfizer for the second jab.
I think it's, again, a really interesting question. At the moment, I think the advice is still, and correct me if I'm wrong, please, but the advice is still that you should have the same vaccine that you had the first time round, unless there was a serious problem with that first vaccine, unless there was a severe allergic reaction with the first dose of the vaccine. Otherwise, you should continue to have both. But there's a recent study called the COMCOV study, which was a mix and match study, essentially looking at whether you could have the AstraZeneca and then the Pfizer. And the results of that seem to be very positive in that the results seem to be very, very effective. So it may well be that in the future there is a change in guidance. I don't know when that or if that will come about. But at the moment, I think the advice is still the same. If you've had the first dose of one vaccine, there've been no significant problems with it, then you have the same dose of the second vaccine.
Yeah, so I did do a bit of reading around that, and they said they would expect any issues to kind of develop within the first 4 days after the first vaccination. And so if you've been okay, then it's safe to go ahead and have the second AstraZeneca vaccine. Brilliant.
Yeah, and I think, again, the issue about the clots, I think that it tends to be after 4 days and before 4 weeks after the vaccine tends to be the time period. And so if you notice in that time, severe headache with blurred vision, a new unexplained sort of pinprick bruising or bleeding or shortness of breath, chest pain, leg swelling, or actually severe tummy pain within that time period, you should seek urgent medical attention.
Yeah. I mean, some of the discussions that I was reading about that was, it's essentially, like you said, like it's about risk-benefit analysis and discussion. So, you know, as medical professionals, we appreciate that the younger population, they are less likely to become really unwell and need hospitalization from COVID. Clearly, there is a risk. There is an element of risk associated with clots, and so people do have to make their individual decision about where they feel they sit on that risk-benefit balance. And you know, your GP or practice nurse will be there to have that discussion with you. We have had a question put through, and this is from our Facebook group. I don't know how you feel about answering this because it's not actually related to the COVID vaccination. But she says, I am a 66-year-old female. I have received a text from my GP asking me to have the pneumococcal vaccine. Could you please put more light on this? And I'm not sure whether to have this vaccine or not. And that is from a Mrs. Hussain.
Well, as I said, I don't know the individual circumstances, and I'm not really allowed to comment on that. But if you're being offered the pneumococcal vaccine to protect against, this is nothing to do with COVID now, really. This protects against pneumonia, basically. There will be good reasons for having that. And especially coming up to winter now, what we're going to be seeing is not just people being offered the pneumococcal vaccine, but also like the influenza vaccine. Yeah. And we're going to be in a very interesting situation. I say interesting, I'm thinking really busy, when we're going to be probably having to offer the influenza vaccine as well as booster doses of the COVID vaccine. So I think it's going to be, you know, a very important winter for immunisations generally. Yeah,
absolutely. And I think, you know, people usually have specific concerns or specific queries, and they are best directed at your own GP or practice nurse, so that they can address those queries for you. In terms of safety, you know, vaccinations and any medications, they go through a really rigorous process of testing, and safety is of paramount importance. So if that is what you are concerned about, then all of the immunisations that we tend to give at winter time have gone through that rigorous testing, and we've been using the pneumococcal vaccine for a very long time now.
I think you know, even before the GP, there's lots of trusted information online. Like the NHS website provides some brilliant information about the vaccines that you may well be able to answer those questions yourself just by some a quick look on online. Yeah. Because obviously GPs are extremely busy at the moment as well, and actually lots of that information is really readily available online via the NHS website.
Yeah. And just quickly returning to the clots, and I'm sorry if you've mentioned this already, but the actual number of clots after the vaccine compared to the number of vaccines given were very, very small. And the number of clots that you can get from the COVID-19 infection is much higher. So that is also something for people to consider when making their decisions. So on to the last segment and last questions, and this is mostly around what's on everyone's mind this year, which is about travel. Will I get that holiday in? Which for me looks like I probably won't this year. I don't think I'm going abroad at all this year. But, you know, there have been kind of certain news reports about potential boosters and needing 2 vaccines before you travel. Are you able to tell us what the advice is at the moment, or what we know?
In all honesty, Sulthana, I do not know exactly what the advice is at the moment, and I suspect it's changing all the time. I'm afraid, and I think we just need to check before you book anything. I think you just need to check on what the quarantine advice is, what the current government website, you know, the government advice is via the gov.uk website. I suspect that in terms of boosters that will come in, I don't think, not necessarily just linked to travel. I suspect that there will be all sorts of rules and regulations going forward that will change. I think we're at that, as you said at the beginning of the programme, a really interesting being one word for it, sort of time now when we're about to open up at a time when cases are rising. So I think we all need to be prepared for quite a lot of change.
Yeah, absolutely. So I did try and find some information on the boosters before I came on, and I think the latest information we got is they're looking into it, maybe September, but basically watch this space. And also, I think it's important to point out that travel vaccinations, again, are not a new thing. Before you go to any country, there sometimes can be a list of immunisations you need to get, and it might be that COVID-19 is just another one that's added onto the list. So thank you so much, Dr. Jamie Parker, for joining us today. That actually brings us nicely to the end of the show. Just before we leave, do you have any websites or pages that you recommend that people can check for further information?
I think two main websites that I'm using all the time are the gov.uk website and the NHS website. I think they're fantastic sources of information and kept up to date.
Thank you so much for that. Everyone, I hope you have a really good evening and have found this useful. Take care. Good night.